If you've ever found yourself suddenly responsible for a loved one's medical care and felt like everyone else knows the rules except you, this conversation is for you. I'm going to tell you a story. My mom was laying in a hospital bed with a big, angry red bump on her head. She'd fallen at her long-term memory care facility and had been taken by ambulance to the hospital. I arrived shortly after she did, and she was stable and waiting to see the doctor. While we waited, a staff member came in to ask for her information. He stood behind the computer, he pulled it from the wall, and in a practiced tone, he started asking questions he'd probably asked hundreds of times. What's the date of birth? What's the doctor's name? What are the current medications? And then he asked something that completely stopped me. Are you going to sue? I remember thinking, wait, what? My mom hadn't even been seen by the doctor yet. She was lying there with a head injury, and somehow that question made the list. I answered no, and the staff member continued on in the same bored tone as if nothing unusual had been asked. But inside my head, I'm thinking, what kind of system treats that as a routine question? And the answer is the U.S. healthcare system. That moment wasn't about my mom's medical condition. That was about liability and insurance. Here's something most people don't realize until they're already overwhelmed and exhausted. In the United States, healthcare is not driven solely by diagnosis, symptoms, or even what your doctor recommends. It's driven by insurance. Behind the scenes, insurance influences what tests get approved, which doctors you're allowed to see, whether care is delayed or denied, and how much financial stress follows these medical decisions. This is why two people can receive the same test, the same visit, the same treatment, and walk away with completely different bills. And it's why caregivers are often asked questions that feel confusing, inappropriate, or even shocking. You're not imagining this, and you're not doing anything wrong. Most of us were handed an insurance card and told, you're covered. No one explained what that actually means. No one taught us the rules. No one explained the language. And no one warned us that these rules would quietly shape our healthcare experience. So when you suddenly become a caregiver, often during a crisis, you're expected to make decisions inside a system you were never taught to understand. That's not a personal failure. That's a system failure. You don't need to become an insurance expert, but there are a few basic terms that quietly influence almost every healthcare decision. Premium, what you pay every month just to have insurance. Deductible, what you pay out of pocket before insurance really starts helping. Copay, a flat fee for certain visits or services. Coinsurance, a percentage you pay after meeting your deductible. And out-of-pocket maximum, the most you should pay in 1 year for covered care. Now, these aren't just definitions. They determine whether a test is approved, whether care moves forward or stalls, and whether a medical decision becomes a financial crisis. This is not about learning to game the system. This is not about fighting doctors or becoming confrontational, and it's definitely not about becoming an insurance expert overnight. This is about understanding the rules you're already being judged by, often without explanation. Because when you have clarity, you can ask better questions, spot red flags sooner, avoid preventable surprises, make calmer decisions during emotional moments, and that clarity changes everything. If this feels overwhelming, I want you to hear this clearly. You're not behind. You're not bad at this. You are not failing your loved one. You're learning something that should have been explained years ago and never was. And once you understand even a small part of how the system works, you stop feeling powerless. I'll be sharing more plain language guidance tools about navigating the U.S. healthcare system, especially for caregivers and patient advocates who didn't choose this role but stepped into it anyway. I salute you. If you have questions about insurance or healthcare that no one has explained to you, leave them in the comments. Your question is probably someone else's too. And remember, advocacy doesn't start with knowing everything. It starts with understanding just enough to protect yourself and the person you love. You're not alone in this. Check the description below for some free tools I have for you. And if you've enjoyed this video, like and subscribe so we can keep making more.